thanks everyone, and let's begin with a roll call.
Recording in progress.
Commissioner Miller. Here. Commissioner Routzon present. Commissioner Carey. Here. Commissioner Michaelek.
Basically having some audio.
Commissioner Michaelek. Jason.
People will get it from my.
Okay. Commissioner Ford.
I can text him. I can text Michaela.
Commissioner Brown Sparks.
Here.
Commissioner Mann.
Here.
Commissioner Yuri. Okay. And moving on to approval of agenda. So, oh, sorry. Are you taking notes? You're taking notes? Okay. So moving on to approval of agenda. Would anyone like to make a motion to approve the agenda as is?
I'll make a motion.
Okay, I'll second. Thank you. And then a member to keep the minutes. Would anyone like to volunteer to keep minutes today?
Okay.
Thank you. Okay, and approval of memoranda and minutes from our last meeting. Does anyone have any changes? Does anyone have any changes to that? If there are no changes, then that's approved. Moving on to reports from co-chairs. Basically, sorry, I'm just checking my text from Commissioner Brown Sparks. We just wanted to introduce the speaker, and Commissioner Brown Sparks has invited Nick here today from Indiana Recovery Alliance, and that a lot of the ways we've been looking at increasing public safety include things that Nick's program is already doing, the Indiana Recovery Alliance, and also teaching us how to have a more equitable Bloomington is what we wanted to share. So thank you for being here today. And if our reports from committees, if we could keep those very short or just to like necessary items for the sake of time. Conflict resolution committee.
I think we decided to suspend meetings in that committee until after the annual report. Yeah, that's the last of, I don't know where everybody on the committee talking about.
Reparations and atonement.
We sent the email off to the mayor and we are waiting to hear back right now. And I know I'm looking into more ideas and doing research on some people in the town. I'm doing some research on the history of some people in the town and some buildings.
Yeah, and we're also working on a follow-up to the two resolutions that we passed to have some more substantial to try to help those communities improve public safety. Okay, research committee.
We've gotten our research from Danielle in the IU School of Social Work, and we've created the PowerPoint. We're hoping to be able to present that the next meeting to you guys, just so that you can take it back to your committees, and we can get that information out to you guys from our first research.
Super, thank you. Alternatives to policing. It's not me.
Is that the response to communities?
right on.
Doesn't get all that.
Tonto.
Who are we merging with here?
My angel.
We can whisk away, you know? Did you ever get a shot?
Do you want to report for that committee, Alex?
Sure, we have, a planning proposal and a timeline for the rest of the calendar year that we've been working on. And, we're identifying the best models out there for a community-based, public safety approach that doesn't have the police at the top of that pyramid. We're going to research those models more and figure out best practices. And the important part of our most recent meetings is that we've decided to ask the commission as a whole if we can vote to dissolve the policing committee, simply because the rules surrounding meetings and quorums for committees have been getting in the way of us actually meeting and actually getting things done. And those rules, for instance, don't count Commissioner Brown Sparks in the quorum because she is unable to attend in person. She can only attend virtually because of a health concern. So those inequalities in counting which commissioners can be part of the quorum or not are getting in the way of us getting any work done. And we also feel that that kind of inequity is counter to the commission's objective as a whole, and certainly our committee's objectives specifically. So we're raising those concerns about the inequality in defining what a quorum is. Yeah, we're going to put those in the annual report, but we're also bringing that up to the commission right now to see if we can hold a vote today and dissolve that committee so that we can then meet as individuals and communicate as individuals, and we won't be bound by the city rules to, announce meetings ahead of time and have a quorum, those kind of things.
Or to meet in person.
Yeah. Right.
We can literally do stuff online.
Right.
That's really scary.
So
Isn't it?
just add a bit more info here. So it's the state's recent revision to the open door law that they passed in the wake of the pandemic. They have rules regarding governing bodies, which this commission is a governing body of the state open door law. Any committees directly appointed by this commission are also governing bodies subject to the open door law. So by creating and directly appointing committees, you all have created multiple governing bodies that are then subject to the open door law. And one of the recent rules for electronic meetings states that while members attending electronically are counted for purposes of quorum, there's a separate new requirement that at least 50% of the members. on that
Recording
body-
stopped.
Yeah.
Recording in progress.
That didn't like what I was saying. It requires at least 50% of the members be present in person. It requires each member attend at least 50% of the meetings in a given year in person. Now, there are some exceptions for medical conditions, military service, a few others. But it's that requirement that at least 50% of the members be present in person. It doesn't speak to any of those exceptions. You just have to always have a quorum present in person. So we count members on Zoom as present, but it's this new state requirement that they be present in person. That's been tripping us up. So if this commission were to dissolve any one or more of the committees, I think the members that have previously been on those committees could still meet informally as needed, as long as there's not a quorum of the full commission. And it seems like that may be a better route. I know at least at first a lot of different groups had formed around certain interests I think now that that initial phase is over, if you all want to move to sort of a less formal, as needed way of tackling the work, I think you're free to do that, but happy to answer questions.
I'm gonna be talking with somebody with the ADA and see if we can get that changed, because it's gotta be changed. So not just for everybody going forward. It's just,
Yeah, I will say it's very new. I would be shocked if they didn't make some changes.
Exactly.
To that or maybe other provisions. So if they solicit feedback, I know the city, not just me personally, but the city's been in touch with the Office of the Public Access Counselor at the state level.
Good.
I know other cities, communities that are working through issues. There's a local group, AIM, Association of Indiana Municipalities, that talks about things like this. So when there's a chance to provide feedback, I would certainly pass along the difficulties that we've had and the inequalities that can come up when members, can't attend from home. So I'll do what I can. It's a state requirement at the moment, so I don't know the way around it.
So in the interest of time, are there any comments on the vote to dissolve this committee at this time?
Do you have to wait until after the annual report is submitted, or would that, like, your committee still be on the annual report presenting and stuff like that? Okay.
Yeah,
Just wanna make
any
sure.
committee that existed over the year, I would include it. That's all I had to comment. Any other comments or questions on this vote? Would anyone like to make a motion?
Commissioner Mann has moved. If there's a second.
Okay, Commissioner Mann has moved. Would anyone second the vote, the motion? Commissioner Brown Sparks?
I was still wanting to comment on, sorry.
Okay,
I just kind of feel like, I would feel better if we waited until after we did our report to disband the commit. We don't have to meet, but I would feel better if we waited until after the report to disband the. I don't know.
On this topic, I'm sorry to interrupt. I did confirm, I think the council is planning on hearing the report on the July 20th date, which was, I think, this commission's preferred reporting date. So.
wait, I think you might be confused. We're not going to actually stop working or anything. We're going to continue to work, and we're actually going to get more done.
Right, no, I know. I mean, I'm just saying we don't have to meet as this group as a whole, like this, all at once. If we can't find a way to meet like as a big group like this, and we still will work individually or together if we can do that. I understand that.
So are you suggesting now that you think we should not dissolve the alternative policing committee until after we give the report presentation to the council? What would that be, July? In July?
Yeah. Well, I don't know. That's a long time. Never mind.
Which one is it, Cammy?
It's okay. What are your concerns? Do you want to share what your concerns are with us? Maybe we can address them.
I just that this is a big part of this commission, and that it didn't remain a part of the commission for a year, and that the city will be like, why didn't you even look into this for a year?
Oh, I don't think, we don't need to include in the report that the committee was dissolved, and if we do, we could always add a note that explains why. Really, the committee's really only are significant as far as being useful to us in use value. They don't have a significance, I think, as far as I'm concerned, as far as, I don't know if we need to even mention that in the report, that we dissolved it, and like I said, if we do, we can explain. But really what matters is what we get done and then bring to the whole commission to approve, right? And so we're hoping to actually get more done without having the technical committee existing.
Right, I understand.
And we're hoping to actually get more work done when we can just sort of meet on the fly when we can, and then bring it to the commission as a whole. So your concerns are about that it might look like we're shirking or not doing our task or mission if we resolve it before 1 year is up?
Yeah, that was all. It's okay. I'm good.
Are you sure?
Yeah, are you sure?
Cammy, you sure? I mean, let's be real sure, Cammy.
Because I can understand the meeting part
Yeah.
of it, and that is very time consuming. But it is an important matter. So if it's important to you, it's important to us.
Yeah, definitely.
100%.
So,
You guys could always discuss as a committee as well.
Yeah.
Like, if you want to do one more formal meeting, so that you guys can like discuss.
yeah.
Table to the next meeting.
Mhm.
Maybe we
Would
should
you-
have have they have annual meetings for like, we should have a quarterly review.
For the alternative to police, and like you guys meet like quarterly, that's what we're suggesting, instead of just like stopping the meetings altogether.
Right. Right.
Here's an idea. I think it's possible to still dissolve a committee and still having a working group that's not called a committee, but yet a working group that's a little less strict, but you still make reports, like you'd still have a spot on the agenda where you could report what you've been working on, and it wouldn't be quite as, no, you can't do that?
Oh.
Well, he's saying no. I was stretching it. I was trying.
Go.
I was ready to jump on that bandwagon.
I don't think all that formality is really helping us. You know, that's what we discussed yesterday, was that all this stuff and being listed here and coming here and even having someone help with, we're actually getting less done than if we didn't have it. Anyway, we can have another meeting of the committee and discuss it again.
That's difficult.
Would you prefer to do that?
That way you guys have time to kind of think about it a little bit more, you know?
Yeah. Would you prefer to have another meeting of the committee first before we vote on this, or what would you like to do, Commissioner Brown Sparks?
I say we can think about and do one of those polls.
Okay, that's not a bad idea.
I
Do it like
didn't
a Google voting thing. Or
Yeah.
Google,
You mean to schedule another meeting?
Google form.
Google form, there we go. Do a Google
Or
form.
time to take a vote?
Yeah.
You're the committee.
Okay.
Okay, well, it sounds like we are gonna table this and have another committee meeting in any case. Okay. Is that right?
Sounds like it.
Or am I misunderstanding?
Okay, we can do it now if you would like, Commissioner Miller.
I don't know what's going on.
So just to kind of get us back on track, there's Commissioner Mann's made a motion to dissolve the committee. There's been some discussion on the motion. I still haven't heard a second. Or I missed a second, I apologize. So if there's no second, the motion just falls away and we move on with the agenda. If there is a second, you can keep having discussion or you can take a vote. So if there's no second, we would just move on with the agenda. Or if Commissioner Mann wants to withdraw the motion, we would also move on.
That's helpful, thank you.
Yeah, I'll withdraw the motion. And the policing committee will meet again and discuss this further. And then bring it back to the full commission.
Does that work, Kim?
Yeah.
That does for me.
That's important.
Hey, housing committee,
Yes, so I did want to take the chance to apologize. I hadn't made the 2 meetings. Everyone said that. I'm more available now, put it that way. The last month has been really hectic for me, so I apologize if I
life happens.
Yes.
All right, thank you. Report from staff.
I think I mentioned the one item that the council schedule has the annual report for the commission listed for July 20th. So just wanted to note that, and I think that's the only update I have for you all.
Thank you. Okay, any public comments?
So we do have a few folks from the public on Zoom. If there is anybody at home that wants to comment, use the raise hand feature. And we can recognize you. Mention looks like Katz is here covering the meeting today. Got Jim Shelton from the chamber. And Sam Doug.
So no, it doesn't seem like there's any comment.
Broadcasting system for Bloomington.
Okay, moving on to unfinished business. Our first item is our guest speaker, Nick Boyle from Indiana Recovery Alliance. And we also have a handout that I'm guessing we're gonna read later, because it seems a little big covering the meeting.
Yeah. This was just for the commission to have.
This is not from you, okay.
Yeah, this is from this is something we did within the research committee, but this is some really good information for us to have as a commission. That way we can pass on that information to anyone that might need it. I'm gonna keep it in my car.
Okay, thank you.
Yeah, it's local resources.
Great, okay. All right, so, yeah, our guest speaker, Nick Boyle, Indiana Recovery Alliance. Thank you for being here today.
Yeah, thank you for having me. Just kind of give you guys a brief rundown of what we do, who we are. And if anybody has any questions, please feel free to ask. Thank you, Kamala, for inviting me to be here, and thank all of you for letting me to join your meeting. So I'm going to read a little bit because I never forget some of the dates, right? Forget some of the dates here. The Indiana Recovery Alliance is a nonprofit in direct response to Scott County HIV outbreak in southern Indiana, as well as an increased hepatitis C infection rates and enormous increase in opiate overdoses in Monroe County over the last few years. Grassroots in our origins, we were initially called to action in 2013 when a young man named Ian Stark died from exposure in an apartment stairwell on the city's north side. We began as a few friends on bikes, distributing harm reduction supplies, blankets, and winter jackets. As we listened to the needs of our people in our community, we quickly added sterile supplies to our services to empower them to mitigate negative health consequences associated with IV drug use. Within months, the worst HIV outbreak in our history broke out in Scott County, and we rapidly expanded our efforts to make sure our community was not similarly devastated. New legislation soon passed that allowed us to offer comprehensive harm reduction services. Since that time, we have reached thousands of at-risk community members, distributed over 30,000 doses, 130,000 doses of the overdose reversal drug naloxone, and mitigating the spread of HIV and hepatitis C in our community by giving out hundreds of thousands of dollars in sterile supplies. We have grown substantially over the years, and this is large part due to our help from the community. The IRA operates under a philosophy of harm reduction to educate the community about health risks and to promote the health and dignity of the individuals and communities impacted by drug use. We respectively collaborate with people to assist in any positive change the person defines it for themselves, beginning where the person is at, with no biases or condemnations, the person's chosen lifestyle. Our efforts advance policies, practices, and programs that address the adverse effects of drug use, including but not limited to overdose, HIV, hepatitis C, substance use disorder, and incarceration. The Indiana Recovery Alliance provides home services to people who use drugs and others affected by substance use in our communities. We do this by administering the Monroe County Syringe Service Program, providing education to participants and community members, and by building the capacity of our community to respond to the needs of the people who use drugs. Indiana Recovery Alliance maintains these services with a full-time executive director and 4 part-time staff and outreach contractors. We utilize a thing called low threshold employment. One of our joys is some people are not ready to meet full-time or traditional employment. When they're not, there's not many options for them to go and receive money to get through the day, to buy cigarettes, to buy food, to buy whatever the hell they want to buy. So we offer something called low threshold employment, whereas somebody, a participant, can come in and say, hey, I'm broke. Can I have $20? I'm like, well, you could make kits for us for a while, provide service for us, and I'll give you money or a gift card, depending. It depends on grant funding. Some sources will not allow us to give cash. So like we have enough donations, we'll give cash. If we don't and we have to do it through a service grant or something that we administer through private funding, city funding or state funding, then we'll follow that letter in the line and make sure that they get them. You have to be really careful about that kind of stuff. Grant deliverables have to be followed, much to the world's not knowing, you really gotta follow them. But we've seen it work wonders. We have a person recently who I've known my whole life and just was confident, almost had no hopes of ever being anything but maybe walking whatever road led down whatever oblivion you can find. He began working with us. We didn't ask anything. He said, "Do you want to work? Do you want to get on the bus? Do you want to help me out?" I was short staffed. That was a year ago. Today he has no catch drug use whatsoever. He works almost every day he can with little to no money. So most of the time he'll refuse it. And he's found a place where he's loved, respected, and cared for. More than anything, his positive mental attitude is okay enough that he doesn't need to reach oblivion. And it's the connection that makes that possible. And it's kind of the joy of the IRA. What we do is we give people connection, love, and dignity that don't usually get it anywhere else. 9 times out of 10, what we're doing is someone's coming in off the street tired or cold or overamping or lost or whatever. They just want someone to listen or talk to them for real, or sit down and get tested in a place that they're not going to go run to the law, or maybe they've got warrants, maybe whatever else is going on. And it's like, well, I tell my volunteers, you got this single moment that could stretch from a minute or two to an hour or two, where you get that person. It is paramount that you give that person as much love, dignity, and respect, and safe supplies as they need. Because you never know. They could be gone. You can never see that person again. You might see them the next time, and they might be worse for the wear or better for the wear. What you do know is you have this window to provide connection, which is one of the best interventions we can use. Sometimes we get to use a secondary intervention, which is that low threshold employment, but that's really what the meat and potatoes is about, meeting people where they're at and treating people who use drugs, not for their drug use, but for the person they are. So what we do is we step outside of their drug use and say, great, you use drugs, don't care about that. What do you need? we've expanded over the years to have now have HIV rapid cure from a partner organization, that people can come in, get tested, and very quickly get a cure in their mouth. And I'm talking like 3 to 5 days to a week. You know, sometimes it takes a little bit longer, it just depends. That's what Positive Link, they're our kind of sister organization of ours. You know. So we are 365 days a year. When I say that, I've been working there 3.5, almost 4 years. We have never shut down. We haven't shut down during the pandemic, where we provided aid all the way from food, clothing, sterile supplies to whatever was needed at that point. At some point, it was just providing PPE to other organizations, you know? Not once did we shut down. We have never shut our doors for anybody. I'm there 10 to 5 almost every day, and we have a pretty much open door policy. We like people to come during outreach, but leaving that door open means that one time, you get that one time, you know, and it's paid off. So like we kind of have a little bit more, we used to not do this, but since I've been there, it's just something that I can't not do, you know? It's something that I see so much value in, I'm not quite sure how to not do. You know? We've had over 2,446 reported reverse overdoses with our naloxone this year.
Amazing.
Last year was 1,700. The year's not over, folks. We are the largest peer-to-peer distributor of naloxone in the state of Indiana. We are also the state's biggest certain service program. We are the national. I'm not trying to brag when I say this, but like we are basically what a best practice is supposed to be. You know, I didn't create this, so I'm not taking full ownership. You know, I am running it now as I see best practices and the board sees best practices. But we are like one of the beacons in Indiana. You know, people come to us for TA, they come to us help setting up certain service programs, answer the questions. You know, how do you do this? How do you set this up? How do you deal with this problem? We've gone to state legislation, federal legislation. We protested on the steps of the DEA, and we walked into Doug Hunziker's office and talked to him, and actually had a really good conversation. But we are fundamentally a participant-driven harm reduction project. What best practices tells us about harm reduction is that if you are not involving people who use drugs all the way up and down the board, employing them, asking them for their advice and their services, and meaningfully engaging in how you can run your operation, then you're not following harm reduction best practices. It is not good enough to tokenize someone, ask them just their voice for, hey, how do you want this? Our participants and volunteers paint our walls because that's the color they want. Our participants and volunteers say, don't give me this Kroger gift cards because that sucks. So we don't give out Kroger gift cards. Literally, the volunteers and participants have more power than me. I am only just an agent of change for whatever I can reallocate. Our mission states that we reallocate resources to people who use drugs. That is the very simplest way I can put it. You know, we take money and we help people who use drugs self-determine what their change is. You know, it's just, our board of directors is entirely composed of people who use IV drugs or engaged sexual. To ensure that no decisions are made that are not beneficial to our active participants. 51% of the board seats are reserved for active sexual workers and drug users. The impact of our harm reduction has had on our community is manifold. We are a PU. This is a loose term, so when I say it, I want to make sure we understand. We blur the lines of what a drug user-led program is. I may use tomorrow. I may use today, I may have used yesterday. We're trying to blur the lines of what is acceptable as a person who uses drugs. That could be someone who smokes a joint every once in a while. That could be someone who drinks a beer. They're all drugs. The whole point is to blur this line. The other point of this is people who use drugs have to inform these services. It cannot be people just with lived experience, which is people who used drugs 20 years ago. The fentanyl risk environment is different.
Yeah,
We're not playing in the same game.
Mhm.
We can't use the 20-year-old heroin data we have,
Mhm.
or from the 90s, to focus our response.
Mhm.
So it is paramount that we have people who are in active use and people who have near limb use to inform our practices. This is the national best practice. Normally, America looks to Canada for its like leadership because it's so far ahead of drug policy. This is something Van Du, the Vancouver area network of drug users, and the INPUD, which is the International People Who Use Drugs, all these those international organizations, they wouldn't even be here for that, and they still call for that. You know, the board of their directors uses drugs, and like a multi-million-dollar nonprofit. The point is to take that out of the narrative that like you're defining roles that you use drugs. Like you use drugs, so you're bad. Well, I also raised 2 kids that are beautiful, have a house, go to work every day. Why is that the defining quality you're giving? You know, just randomly. So we are a drug user run SSP, and that worked hard to make participants drive our policies. We've had over 490 people referred to testing. We distributed, like I said, 130,000 doses. This year alone, excuse me, 2021 alone, we distributed 27,000. We will greatly dwarf that now. Through Overdose Lifeline has provided us pretty much all the days on naloxone we can use. We are giving out close to 2,000 doses a month sometimes. We support many peer-to-peer distributions, which means that when you're starting to put naloxone into people's hands, you can do one of 2 things. You can just give it out carte blanche, which is good. But if you get into people who use drugs hands, or their allies, or their families, you get over. It's just the fact. So when we talk about being peer-to-peer, the reason we state that is there are a lot of people that say, oh, we'll mail it to you, we'll do this and that. We give it to people actively use. We then train them. We then train them to train other people. So in their communities, like in Crawford and other places, there are people there that have literally reversed probably hundreds of overdoses because they got trained. Because they got trained to use it, and we never said you can't do this because you're a drug user. In fact, we said you're the perfect person. So yeah, like I said, we're on the most effective fatal overdose program in the state. We run the most effective overdose reversal program in the state. We recently hired a development director and have been involved in several policy initiatives, such as extension bill to the sunset clause, and we traveled from DC. We traveled to DC with NASDAQ, AIDS United, Open Society, and others. We've engaged in countless interviews from local zines and newspapers, NBC News, Vice News, Fox, Mother Joey's, etc. Spoke at many conferences, from national conferences to opioid settlements to prescription drug symposiums. We continue to push the envelope for drug user rights and protections. In 2000, so that is, yeah, and that's why I'm worried about something, always drives me nuts. This year, we started 3 main new projects other than our syringe service programs. One is a COVID vaccine hesitancy. I'm trying to explain this the right way. We're trying to find out why people are not taking the vaccine. We are then providing facts. We are not biased. We are not telling people to get the vaccine or not to get the vaccine. What we are saying is, here is the thing you're telling me, this is why you're not getting the vaccine. Here are the experts, what they say, and what the facts are. That's it. Make your own informed decision. What we don't want is people getting news from a bad source that they just didn't think is the truth. A lot of times we'll find, why do you think this is? We've ran the gamut from people telling us that Jesus told them that they shouldn't get the vaccine, to something like, oh, it's got gonna turn you into a chimera, or it's gonna, it's got the technology to put in microchip in it. Well, we actually went and researched that stuff. And we actually found the research that disproves or proved it. One of the things that we found that was really odd is they had talked about the RNA and RNA wrapped virus, and they're like, this is a really big problem for us. So I thought that was newer technology too, until we talked to Nabaru Descupta out of North Carolina, who explained to us that he'd been working on that exact delivery system for 20 years. And it's things like this that, we can provide without bias, letting people make their own informed choices on science, on fact, rather than making it on emotion. And that's one of the big things we talk about is a lot of us, who have lived through these experiences, we make choices on emotion, or what we call our gut or our intuition. And sometimes that's exactly what it is. It's just an emotive response. Whereas if we stop and look at the facts of what will work, and show the facts, people change, people think about things. They'll at least go home and go, well, I was wrong about that, We aren't at the stage of this particular grant where we're offering vaccines. We are offering referrals to vaccines for people if they choose. But this is not, like I said, we just started this, but it's been fascinating. So hopefully what we hope to gain out of that is people's myths dispelled, debunked, and facts in their hand. And they can make their own choices from that. So our metric is how many people can we get to understand these are the facts. These are just another program we did is we are joining up with the state for what's called a harm reduction street outreach team. It's the first of its kind. It's a pilot in Indiana, but it's really a pilot all over. State grants are not normally offering this. Basically, all it is we provide naloxone and a kit that has several things in it. Like I always say, it's like Narcan, wound, and whatever, right? So you have Narcan, then you have wound care, then you have what else? If it's hot out, water, deodorant, whatever. If it's cold out, hand warmers, gloves and socks and hats. You know what I mean? So the state just really gave us money to do just that. Indiana Recovery Alliance is TA the other, or offering technical assistance to the other 9 groups along with the Never Alone Project. So us and one
Sorry,
person,
what's the name of the
Never
project?
Alone Project is the other one that's doing the technical assistance with us. So we are talking to 9 to 10 organizations, harm reduction focused organizations across the state, and helping them with technical assistance, helping them start certain service programs, helping them talk over. In some places, unfortunately, in Indiana, fentanyl testers are illegal and they bust you for a paraphernalia. So we're talking them through what to do about that. Recently we've always been really close with the Scott County people, and this last January they shut Scott County down. The Scott County system, which was horrifying. As we all sat in there was like the Surgeon General of the United States and all of the people from all over that you can imagine were saying, don't do this. These 2 commissioners shut it down. A wonderful woman named Kelly Hans pivoted and found that the law said you could just go to municipalities. It didn't say county, it just said municipalities. So Kelly went to the city and is trying to start one through the city. They're now kind of backdropping and backpedaling, but she's fighting and she's probably gonna get it because she's tenacious and she loves her people.
Good.
Yeah, we help. So we provide TA there too as well. The third initiative that we're really happy about is public health nursing and IU have done a lot of good work, especially with the nursing hospital and student nursing hospital. And they've been pretty integral in Bloomington for a while. And one of their professors had asked us, would we like to do a clinic? And I said, well, what do you mean? He said, well, what we'd like to do is have people who are getting their nursing degrees have harm reduction and drug user stigma training as part of their actual curriculum. So people who use drugs face horrible stigma in the medical world. Most won't go into a hospital or into a doctor's office because all they're going to get treated as is human filth because of these substances. you know? So this would provide something as a counter to that. We would end up being able to teach these people as they're learning what harm reduction is, why it's important, why treating people with substance use issues decently is paramount. You know, and we all know what happens when you're learning at that age, you're in school learning, these things come by the road. It's way easier than 5 years down the road, having to explain that to them when they're set in their ways and they picked up from other nurses who haven't had this training and don't view harm reduction as an effective tool. So it's really amazing that we get in there early and have, you know, and have that influence in the beginning. And we're still a syringe service drug user health hub, so we offer all, you know, when I say drug user health hub, I mean that we offer not just syringe service program. We offer the full gamut from wound care all the way to treatment for Hep C. The last thing I would say is I'd be remiss without saying that the Monroe County Public Health Department partners with us for our syringe service program. We are lucky. We have one of the best relationships with the public health department that I have seen in almost every place, and I'm on national boards. I see a lot, you know. Kathy and Penny and Melody and all the people down at the health department are true allies and true champions. They help us do just about everything. They're an integral part of our world, and really are kind of the gold standard for what a health department can do, partnering with a syringe, you're partnering with a grassroots harm reduction program, you know. I'm actually speaking at a seminar soon to discuss our relationship because it's just so neat. It's just so, you know, it's very different than what most people have. Most people have an adversarial role with their health department when you come to passing out syringes. Here, there's no adversary. And I guess the last thing I'd say is we are entirely grant and donation funded. We are an integral part of your community. We are the ones picking up syringes that are discarded because they're a felony, not because people are bad people or dirty. We are the ones who make sure we spend the most time with our community's marginalized people, you know. Those most directly impacted are who we serve. I wouldn't have it any other way. Those people are the most beautiful, vibrant, wonderful, creative souls I've ever met. You know, I've grown up in this town my entire life. My mom worked 27 years at a warehouse. My entire family works in social work. And as I started to work here, I didn't realize that, like, I'd been waiting to do this my whole life, you know. And in Bloomington, you know, there's a lot wrong with Bloomington, don't get me wrong, but like, it is an amazing piece of the world sometimes, you know. So again, you know, I always feel the last pitch is funny because, you know, since we're a small organization, one of the things I will throw out to you guys is that we are looking for a building. So we had the health department has signed a letter of how would you say that? Signed a letter saying, yes, please help IRA fund their own building. We don't know where to find things like this. We're looking into it. I asked the mayor, you know, didn't have an idea. We're asking the city council, but my hope is that somebody somewhere knows of a building in the downtown area or in the radius of down here, again, like close to downtown, being like, you know, I don't know, 15th Street the farthest. And maybe Dodge or Dixie or something a little farthest that way. We have just outgrown, you know, we need places for recovery meetings, harm reduction meetings, drop-in centers. We need a place that harm reduction can become, it can flourish and it can grow. Right now we have a small office, you know, and it binds our hands a lot of times, ties our hands a lot of times. Because
Is it on
with,
Rogers?
yeah, it's the old, for everyone who's been here first, the old DMV.
I've dropped off needles there that I found in my property.
Yeah, and see, that's the thing, it's like a lot of times these needles that get dropped everywhere, they're not a sore, and I get that, but that's directly related to them being a felony. If these needles were not felonies, no one would do that, you know, we also find that like, and this is fact, these things are factual basis, you know, it's like, we don't just pull these out of our head, we looked into research. Syringe service programs curtail a lot of that use. Or a lot of those self-disposal. Our services are always free. We give trainings throughout the state, throughout the city. And, we just feel like, you know, we're such an integral part of our community that I hope our community is gonna get behind us. You know, we hope our community is gonna say, hey, we got you, let's find you a building, you know, or, you know, something to that nature. And it's kind of hard because, you know, trying to help an organization that's focused on people who use drugs. You know, people who use drugs are not the most popular people to our society because they all view us as broken or wrong. You know, I defy that and say we're not broken, we're not wrong. You know, it's the environment. Are there any questions?
Thank you for what you do. Definitely. So I can imagine how our city would be if we didn't have that resource to help so many people that need.
I don't want to imagine it.
Yeah, thank you for all that you do.
Yeah, you identified a need and you found answers. I have a niece that did something very similar, her name is Katie Morris.
Okay.
I figured you probably did. Yeah, so, I commend you for that, identifying a need and then doing something about it, since we need more people like you. I do have a couple questions. Will the building that you're looking for, are you hoping it'll be a safe injection site?
No. If Indiana law is not there yet, we wouldn't.
It's too bad. It's too bad that
It
it's
is too
not.
bad. I wish I could, like, I would, what my next big push will be is for drug checking.
Mhm.
So right now, we have a school with mass spec and FTIR technology. Fentanyl test strips are not enough.
Yeah.
They are not doing, and they were made to do your analysis with. They were not made
Right.
to test substances, right? People are falsely believing that, oh, if I have a test strip and it shows up negative, I'm okay. That's not right. That's not okay. So the hope is that we get drug checking services so that people can anonymously put it in something, like you have like a plastic bag with a barcode on it. They don't have to put much in, like it's not enough that could hurt anyone, just enough that we can test. And then put that on a thing online that says, this sample, X1202, contained lead shade, contains xylazine, contained whatever. In North Carolina, they do this, they have watched people throw their drugs away. Like, they didn't understand what was going on until they came and looked at like the odd bag in there. And the guy had thrown away like enough drugs to be like, what the hell? You know?
Right.
Because people don't wanna die, drug
And they
users
don't.
wanna be healthy.
Yeah, and they don't understand.
No.
What they're doing. Well, thank you, that was one. I think you actually addressed the stigma when you were talking about IU Health, and I think that's a great idea to go in and talk to the students and everybody else, so we can start decreasing the stigmatization, because that's what I see mostly as a problem in Bloomington, is the stigma being a problem, the stigmatization. So I think that was all I have. Thank you so much.
Yeah, absolutely, stigma is like probably one of the worst problems, one of the worst big umbrella problems we face, you know? You take every intersectional part of drugs, you know, you take HCV, HIV, sex work, you take mental health, you take all these are drastically exacerbated by a world that doesn't have time for them. And then if you don't get clean or sober their way, then you're worth nothing. Then you're not pulling yourself up by your bootstraps, then you're not a worthy human. The statistics show that 90% of people they age out of drugs, even chaotic drugs. You know, we don't utilize things like methadone enough, which is 67% of people never go back to drug use after prison. The statistics are not the same with any other substance, MAT or other, you know? We just need to understand that there are ways we can fix things that may not be comfortable to some of us. And some of us are gonna have to buck down, you know, since either save lives, you know, but more than that, like not just. So I'm ever hopeful, you know, every once in a while I'll see a change that I'm hopeful is gonna stick around and become more, but stigma truly is one of those things that is, I mean, even my own life, like, I spent a long time in prison. And, when I got out, every time someone overdosed, they came to me to ask me if I knew where they got the dope. And I mean, I'm like, seriously?
Like, you would know that,
You
right?
think in prison I had it all sitting there with Pablo or something, you know, like, and that kind of stuff's hard to take out.
Yeah.
But it's well worth it. I think I know you. You hear
I did.
that? I don't know.
I don't know.
I have a question. Can you hear me all right? Okay.
Yep.
So one of the things that I found compelling that you said was like you grew up here, like this is your community, right? And which is a lot of reason that a lot of us volunteer because this is our community and we want to change this. I'm also thinking though about changing the culture, right? And so I volunteer at Shalom Community Center, and one of the things that I see is not just direct help from people who are staff or volunteers, but I see guests helping each other. And so I'm wondering, have you seen success in helping people and then them helping other people saying, you know, I know it's hard, but like, I'm here for you. I'm here to help you. Do you have targeted programs like that? Or is that just like something that sometimes occurs, if that makes sense?
Yeah, I think really the whole thing people miss is that they don't have, when you're in that world, whether you're chaotically, you're in house or whatever, you don't have stability from normal society. You do, however, count on your street family. And your street family is just the same thing as what a nuclear family looks like. It is brothers and sisters, it's people willing to die for each other, it's people having their food to make sure that everyone eats, it's people sharing drugs that they would never normally share to make sure each other is okay. Like there's a whole, I think it's fascinating to me that most people think the wrong thing about that. I would say that there's not a facet of that life that isn't directly affected in that way. You know, I mean, I watch people, like I said, I watched one guy who's reversed 3 people and he doesn't use drugs. And he sticks around Crawford all the time to make sure that these people will be alive for the next time he comes in, you know, or for the next time he comes around. You know, it's absolutely the proof is in the pudding. So yes, I think that is that way. Did that answer your question?
Yeah, absolutely. And that's also what I've experienced as well. Just overhearing conversations, right? So thank you again for the work you do.
No, thank you. We partner with Beacon once a week, twice a week. We take our outreach man there, there and at Crawford, you know. We're hoping to get to a couple other places, but like, you know, it's just hard. It's a slow go, you know. But at this point, we used to just go to Crawford and Shalom. We now go 3 days a week out meeting people where they're at camps. So literally, we just go out and meet people where they're at camps. That is,
Nick, that was good.
Do you have any direct collaboration with the Bloomington Police Department?
No. Not only do we not have direct collaboration with the police department, we haven't spoken, there's nothing that we have need of yet to speak with the police department. No, I never even had a conversation. The closest I got was the mayor asked me to come to his office. It, discuss with him the state arm production, what I was asking for some good, so, he's real nice, man, just asked him what I thought about the homeless situation. Told him that I thought that, we should buy a piece of land and let them self-govern. He didn't seem like opposed to that. I mean,
He didn't write you a check either.
no.
Yeah,
But we're also trying to look into that, it's new word, but settlement money is a new word. But,
that's true.
yeah, so it's one of those things that we'll just never hopeful. He can change, we all do. But no, we don't. We, at one point, were engaging, ex-police captain to help us write a bill. Because we had to have that language, we don't speak police, so we needed like, hey, will this speak to you?
Consult, but that's not an official collaboration with the department.
We've all been so hurt by it, like, I can't imagine what that collaboration would even be, it's hard, it's really hard.
Thank you.
Absolutely. Any more questions?
So real quick, just because I know you're starting new programs and all of that stuff within the town. And as we're preparing our annual report, I know the research committee, like our preliminary research shows like the community does want like harm reduction, that's a big focus on what safety is. So is there currently work that you're hoping to do? Obviously, you mentioned the new building. And anything that we can kind of advocate within our report or think about possibly advocating for the IRA and just the general community.
So first of all, we don't really have a building. We can advocate for that.
Yeah.
Funding is always a problem. So funding for predominantly syringes and operating costs is really hard. There's a federal ban on funding for syringes, right?
Yeah.
That might change in the next 2 years, 3 years. Excuse me. We hope so, I mean, to be honest with you, funding is, better funding, better partnership. Like we want to be as involved in the positive change in this county and this city, helping us by donating on our Facebook page is good, or on our website, coming in to make nonsense kids, we also let people take those to them. So it just be, a bag of stuff, you make them, then you bring them back. That's how we save lives,
That's right.
Well, speaking as a member of the alternative policing committee, I know that it sounds like you definitely have a lot of expertise and wisdom in what we're trying to do. So I hope we can communicate with you further and pick your brains and hopefully involve you in some of the community outreach that we're doing later this year to try to, suggest some very specific programmatic approaches. You're doing a lot of the things already that we need to have done, and you're doing it with very little staff.
Yeah, it's always a.
Well, very little official full-time and part-time staff.
Right.
Yeah.
It's also that much money, like
Yeah.
the problem is bad money to hire staff. I mean, like, I don't necessarily need the money for Galvin to Spain, like I need money to make sure I can pay full time. Make sure I can at some point get insurance, to go on the market. Just 1,000 things like that, Unfortunately, funding is such an oddball. Like I didn't know this until I got into the nonprofit industry, funding is very restricted. It's usually programmatic, it's not operations,
Earmarked,
right,
yeah.
it's not operations or general operations funds. It also doesn't cater well to illegal syringes. You know, there are felonies in the state, so you think about it, it's like, we can operate a certain service program, we can't. Yeah, so it's, yeah, it's really a
I hope you've got some good lawyers.
yeah. Really good lawyer. Yeah, and you know, that's the thing, we're trying to like, you know, first we're gonna do hearts and minds.
But we all pass,
Yeah,
they all pass.
yeah,
I
and if
mean,
we have to, you know, hit a few balls, then we will play.
yeah.
Wakari,
Yeah,
my
thank
son.
you.
What'd you say?
Wakari, my son. Wakari, my son.
What?
Wakari, my son.
Still
Wow.
don't
Wakari, my son.
Oh, I don't know what it means,
Sorry,
huh?
listen.
What does it mean?
I don't understand.
Gotcha.
Oh, shit.
Yeah.
Did you have any questions for Nick, Commissioner Brown Sparks?
No, but I would like to get with you and work on some of the programs that you're doing and try and see if we can help you with them.
Please, I'd love it. Wakari.
No, that means I don't understand. You would say, hi, so does they. That means, yes, I do. Like, yes, I do.
Is that Yoruba?
Yes, I like that a lot. Hi, so does they. Like, yes, I like that a lot.
Gotcha.
Well, thanks for that lesson. All right, well, thank you so much, Nick, for
Thank you for
your
having me.
Nice to meet you.
presentation. In the interest of time, we skipped our usual bathroom break. We usually take a bathroom break, but we skipped it this time. And since we're at 6:35, if there's any, I would suggest, I personally would suggest that we try to move anything that's not necessary to next month's meeting. And so I'm trying to look this over and decide what is essential for us to cover.
Yeah, nothing ever happened with the farmer's market thing anyway, so it can be taken off altogether for now. We can address that at a later date.
Yeah, hopefully new business, we could just move all the new business over.
Right, I think
So
so.
after our annual.
I don't even know what signature commission program is.
I'm not sure either.
Sorry, that was the idea that came up last month, rather than asking for a, for money,
That's it.
budgeted items like,
I'm just.
parking, childcare. I think a lot of the other city do get funding for a particular program or a signature program, so it's just, is that something you
Let's
want to
move
do?
that.
Yeah, we definitely want to do that in the alternative policing, come in there and tell you that.
It's not urgent.
Right, okay.
Yes, yeah, we can definitely do that.
So what about the updating bylaws regarding co-chair rotation? Commissioner Miller, I know you've been working on this with, Stephen.
Like happens.
I'll let Commissioner Miller speak to whether she feels this is urgent. The proposed language is on the back page of your packet. I know this just got shared a day or two ago, so
This is just
unless
about,
Commissioner Miller feels it's urgent, it might be worthwhile to let folks think on that, and if there are any suggested edits, we can workshop that between now and next month.
Yeah, I think I need a little time to look over it, just me personally. God, we realize it. On there.
And partly, I just want to make sure it encapsulates what you all want to do, so it's not a bad thing to think and work on it, I just want it to be, clear to everybody, so if you're okay letting folks digest it. till next time.
I think it's better to have time than to do anything in a rush.
Yeah,
So,
definitely. All right, so then the annual report to council, I I think the only thing with that is, I mean, I basically sent it out to everyone and,
It's just a space to talk about in the updates. I wanted to give you all the dates, which I did, which is July 20th.
and we still can add things and change it before we present in July, right?
Yes.
Okay, so that's not a hurry either. Then the only other thing I realized is not on here is, deciding who the new co-chairs are, right? Doesn't our co-chairship end this month,
So
or
that
this month? I think June is,
commission
well,
Yeah. When it's-
yeah.
take the
So
voices
we're
of the
supposed to
people
technically
into
have new
government
co-chairs for
because
next month,
Voices of the people.
and
don't
somehow
take
I
it.
didn't get that on the agenda.
That could be the first item next.
Yeah. Does that sound good to everyone, to make that the first item on the agenda next month?
We kind of
So
like,
you will just over.
We've made that transition.
And that's all.
Yeah,
Yeah.
and that gives us all the time and the flex, sorry.
yes.
Sorry, before we're done,
And Roger?
Sorry,
almost
I'm
done.
not done yet, yeah, we're almost done, sorry.
That's all.
Oh, no, it's okay, so, that's okay, so, we were just saying, the last thing that we, need to, that's not on the agenda that I forgot is deciding on the new co-chairs, since, Commissioner Brown Sparks and I's co-chairship ends this month. So we were just discussing the possibility of putting new co-chair elections at the top of the agenda for next month's meeting.
And then whoever that person is that decides to volunteer.
And that gives everyone time to think about if they want to volunteer and maybe even contact other people and ask if they want to co-chair together and, whatever.
Yeah.
So, does that sound okay to everyone? Any comments or questions?
Yes.
Yeah, that makes sense. Put it to the beginning of the agenda.
Commissioners, Brown Sparks and Michaelak, how does that sound to you all?
Yeah, that sounds like a good idea to give us time to think and time to talk.
Sorry, I didn't think to put that on the agenda until now.
Feel free to questions if you have any.
All right, then I guess everything else, we're gonna move to next month's agenda and,
And did you hear that we were suggesting that we would like to present, so we'll need a little extra time? Okay,
Yeah.
very good.
all right, then I would invite a motion to adjourn.
Make a motion that we adjourn.
Yes.
I know.
Eh,
No objections. All right, thank you all.
Perfect.